Welcome to the Swirler Radio Aerosol Instructional Program. The following video covers 4 sections. How to assemble the Swirler Aerosol system. Set the patient up with the swirler. Operate the swirler. And dispose of the Swirler Aerosol system. In Section 1, we will learn how to assemble the Swirler Aerosol system. For your convenience, the section name and step number appears in the bottom of the screen. Attach the Swirler Radio Aerosol Shield to an IV pole or table surface for convenient aerosol administration to the patient. Assure the shield is upright and secure. Remove the Swirler Aerosol system from its packaging. Components include aerosol system, mouthpiece, nose clip, and L connector. Attach the oxygen tubing to the swirler oxygen stem by holding the stem at its elbow with the opposite hand and pushing firmly. Connect the loose end of the tubing to the oxygen source. Check the oxygen source and tubing for obstructions, leaks, and secure connections. Attach the Swirler Aerosol system assembly to the retaining mechanism on the rear of the shield cover. Snap the assembly securely in place. Place the cover assembly complete with the swirler and attach oxygen tubing into the shield. Check for proper gas flow by slowly adjusting the oxygen flow to 8 to 12 liters per minute at 50 psi. Place hand over the exhaust of the swirler to ensure a steady oxygen flow. Note that if a water bottle or humidifier is attached to the oxygen source, it must be detached for the system to operate properly. Turn off the oxygen source. Prepare the pharmaceutical according to the manufacturer's instructions. Inject the pharmaceutical into the swirler through the injection site. We have completed assembling the Swirler Aerosol system. Our next step is to set up the patient with the swirler. Attach the mouthpiece to the convenient L connector, which is loosely connected to the swirler, and position the shield assembly on the patient's right side. The L connector can be used in a sitting or lying down position. To reduce slippage, remove the skin oils from the patient's nose with an alcohol swab, then apply the nose clip. Place the mouthpiece in the patient's mouth, making sure the tongue is under the mouthpiece. For a good seal, the bite bars separate the teeth and the lips are over the mouthpiece flange. In order to reduce risk of pharmaceutical leakage into the environment, ensure that the mouthpiece is secure before initializing oxygen flow. Also, be prepared throughout the procedure to shut off the oxygen flow immediately if the patient disconnects from the system. Instruct the patient to take several test breaths from the system before the oxygen supply is turned on. This assures that the oxygen flow is unimpeded and familiarizes the patient with the breathing techniques. Gradually, turn on the oxygen supply, taking 2 to 4 seconds to attain a flow rate of 8 to 12 liters per minute at 50 psi. Do not abruptly turn on the flow rate to a higher setting, for this may detach the oxygen tubing from the swirler. Instruct the patient to breathe normally through the system until the desired amount of pharmaceutical is delivered to the lungs. At the completion of the prescribed inhalation period, turn off the oxygen flow and detach the system from the patient. After using the Swirler Aerosol system one time, it should be disposed of along with the mouthpiece and nose clip, using appropriate techniques for the disposal of radioactive and biohazardous materials. Prior to removing the swirler from the shield, label the disposal bag appropriately. Disconnect the tubing from the oxygen stem. Disconnect the cover assembly from the shield with the Swirler Aerosol system detached. Note that the cover assembly shields the operator from the swirler aerosol system. While holding the detached cover assembly upright and with the swirler aerosol system still attached, slide the disposal bag over the complete assembly. Place pressure against the swirler aerosol system to dislodge it from the cover assembly into the disposal bag. Draw tie and place the bag in a decay storage. We have completed the instructional program for assembly, patient setup, operation, and disposal of the swirler. A remarkable advancement in aerosol technology.